Well, I'm a victim of jelly belly jelly beans, I guess you could say. I had a lower cap that was pulled off by a jelly bean, and the general dentist said that this tooth needed to be extracted. I was very concerned about that, having a tooth pulled, but because the enamel had been worn off the tooth, it had to be extracted, and he recommended perhaps having an implant, and that's the direction I'm headed.
Implant restorations are more permanent, they're more natural, they look like teeth, they act like teeth, you can floss around them, and if I were to have a missing tooth, I would have an implant placed in that spot.
The first step was actually extraction of the tooth. They rocked the tooth gently back and forth and extracted it. I did not have a sensation of pain, and it healed very nicely, and I came back in for a look, and they said I'm ready for step 2. Step 2 will actually be putting the post in. It's healed really nicely, and so I don't really have any concern today with the next step as we go ahead and set the post in for the final phase of this tooth. I've really been impressed with the staff of this facility, the care, Dr. Patty and his team. They continue to work with you and educate you on what they're going to be doing, the steps that they're going to be going through, putting you at ease every step along the way. I've been totally satisfied, and I have no anxiety, no fear of today's particular procedure.
Since your tooth was removed and a bone graft was done at the same time, it limited the amount of resorption of the ridge or the available bone to support the implant. In fact, on yours, there was so much gum tissue that we could do what's called a transmucosal technique, which basically is using something similar to like a cookie cutter that would make an opening in the gum that was exactly the same size as the implant that I was getting ready to place. So we did that, which gave me access to the implant site. Then we used the appropriate drills, prepared the osteotomy, which we refer to as the portion of bone to receive the implant. Then the implant was placed and it completely filled the bone that was removed. And then, since your jawbone was so good and the bone was so plentiful and so stable, the implant was stable, so we could go ahead and put something into the implant that would protrude up through the gum. And the purpose of that is we don't have to go back and do another surgical procedure in 2 months to expose the implant. All it does now is heal for the next 8 weeks, and during that time, bone will incorporate around the implant and it'll be stable enough that your dentist can start fabrication of the crown. There's nothing else that has to be done surgically. There's nothing else that's going to require any local anesthesia or Novocaine in that area.
Well, Dr. Patty, just a few minutes after the procedure, I'm not experiencing any pain. A little bit of fat lip right here, but is that unusual?
No, not really. The backbone of any good dental procedure, not just implant dentistry, but any dental procedure, is just getting good local anesthesia. The particular thing about an implant is just that prior to having one, your impression of what it's going to be like can sound really bad. You know, you're going to make a place in the bone and you're going to put a screw down in there. But
painful.
It does sound painful, there's no doubt about it. And that's why we just try to coach people and encourage them and comfort them while we're doing it. But most people have the same reaction when we're done as you did, that they can't believe we're finished and that it was painless and it wasn't noisy and there wasn't a lot of pressure. And they were really comfortable.
Well, thank you for saving my smile.
You're very welcome. Glad to do it.
Well, today I finally had the new crown put in place. You know, it really wasn't painful at all, and there really wasn't any discomfort associated with it. Most of it was in my mind what I thought it would be, but actually it was a great procedure. We were in and out. It didn't take as much time as I thought. And again, being able to chew, it's been fantastic, and it's something that I don't second guess. It was a great decision.
Bill came to me from Dr. Patty and had an implant placed to replace a missing tooth, and the implant was placed pretty much perfectly in the correct position. So I had to take an impression of the implant, and I sent the impression to my master lab technician, and they fabricated a crown that fit custom into the implant. And so now Bill has a tooth where there was no tooth before, and in my opinion, implant restorations are the best way to replace missing teeth.
Going into the procedure, I had a lot of anxiety. Is there going to be a pain associated with this? Having a tooth pulled, but Dr. Patty and staff put me at ease, talking about the treatment plan. Again, it was a quick procedure. It wasn't painful at all. Anyone considering a dental implant, it's money well spent and time well invested.